Hi, I'm Dr. Gary Petrus. I'm a facial plastic surgeon. I specialize in hair restoration along with other cosmetic surgeries. We have some frequently asked questions here I want to go over today, specifically related to hair transplant. Male pattern baldness or female pattern baldness or hair loss is a hereditary progressive condition, and it's familial. You inherit it from your family usually. Thank you very much. And it involves sensitivity of certain hair follicles to hormones in our body. Testosterone and dihydrotestosterone, which is called DHT, is well known to be the main culprit for causing hair loss in men. And hormones also affect female hair loss, and that's the cause of it. We're here to talk about some other questions, and just people have asked. I thought maybe does it do a hat? Can a hat wearing or a certain shampoo cause hair loss? And in general, no. It's very rare for hair loss to occur from wearing a hat or even a hard hat. It's possible, but highly unlikely. There is another form of hair loss called traction alopecia, which can be from really tight braiding in the hair. And over time, the pulling on the braiding of the hair could cause a little bit of hair loss. In general, these are very minimal pain is involved with a hair transplant. It's not completely pain-free because we have to numb the scalp up with a couple of little numbing injections in the front and a few in the back. The numbing shots are very quick and like a little bee sting. And we have techniques with a vibration device to make it more comfortable. We also offer sedation, which is a good thing for patients most of the time because it's hard to sit still all day long and just be laying down in the surgical position. And you can take breaks, of course, but it helps you relax and and a lot of patients will actually fall asleep while taking the sedation. We usually use Valium. Sometimes we'll do some in the morning and some in the afternoon for the patient. It's a tablet form. You have to have a driver if you take Valium, just for safety. We don't want you on the road after taking that for 24 hours. So if you do decide to opt for Valium sedation, which is a great solution, I think, and we do that in addition to the numbing injections. So after the scalp is numb, it's really, you won't feel anything at all. Patients say it's super easy. Most patients say it's much easier than the dentist, for example. I hear that a lot. It's not, of course, everybody's different, but we try to minimize the pain involved with the hair transplant. It's very tolerable by men and women. You need about a week to heal up after FUE surgery, follicular unit extraction. For the first 2 or 3 days, we want you to take it easy and kind of chill, lay on the couch, prop up, watch Netflix or something, and just relax a little bit. Most patients can do some work on the second or third day after surgery, depending on your job and what you're doing. But on the third day, also, you can disguise it with a loosely fitting baseball cap. Works for most patients. I would wait for about a week to resume your normal exercise. At a week after FUE, then you can go ahead and go to the gym, do yoga. You can do, run on the treadmill, run outside, swim. That'd be fun. That's okay. If you have the FUT or strip surgery, where we actually remove a little strip of skin from the back and stitch it up, then we'd want you to wait for 2 weeks and before the stitches are out, before you start swimming or lifting weights. I would, because weightlifting in the back with the strip can actually pull on the scar and make the scar a little wider. So I think it's better if you're a heavy duty weightlifter to not do back exercises or neck exercises for a few weeks after the FUT. But with FUE, it's much simpler. It's minimally invasive. There is no scar back there. There's no stitches. It's really almost, there's almost a scar-free surgery, really. If you shaved your head after FUE, you might just see a couple of dots back there, if anything, for most patients. But so with FUE, you could go ahead and just after a week go back to your normal workout routine. The answer is actually no. The hair that we use in the transplant is taken from the back and the sides of the hair, and this hair is actually different from the front and top and crown area. This hair for most patients is sort of programmed, you know, in nature to not fall out, not to be susceptible to testosterone effects and hormone effects. And that's why you see some men, for example, with a lot of hair loss, they may be completely bald up here, but they usually keep that ring or that U shape around the back and over the ears. And that's the hair that we go for, that we take part of that hair and borrow from it to make the grafts to put to transplant. So that hair is permanent and will be with you for life. One of the things we'll often do is do some other things to also keep all the other hair in place with some medications and laser and other things that we could offer. But the goal is to keep as much, keep everything in place as long as possible. But the hair that we transplant should be permanent in 99% of the cases. A micrograft is actually a very small hair follicle with usually one actual hair and hair follicle in that graft. Those are smaller naturally occurring hair follicles. We punch it out with a very small punch during the FUE surgery, and then we use that to usually put in the very front and the trim the edges, like in the temple and stuff, because that's in the front. It's very fine hair. It looks more natural when placed in the front like that. And that's what we use. Those are called mini-grafts. Now, a micrograft is similar. It's like a grouping, but it's a grouping of follicles that kind of grows out of one spot of the scalp. Sometimes at one pore area, you'll have multiple hairs, and it'll be sort of like a palm tree of 2, 3, 4, even 5 or 6 hairs in one grouping. And the groupings are all extracted in one punch. And we call that a mini-graft, and which is kind of nice, especially for hair density, because it makes your hair thicker, because one graft will have up to 5 or 6 hairs in it. But it's commonly 2, 3, and 4 are very common, especially 2s and 3s, as we call in the business. And those mini grafts are great for behind the front hairline, just making everything full and dense and look thick there. Now, plugs are an older technology. Thank goodness the patients that did that back in the 70s were willing to do that. Back in the day, that was something that was available. It was basically a large dermatology punch. There were big circles of hair, and each hair was a big circle like the size of a dime or so, and it had 100 hairs or so in that. And they were lined up in the head, sort of like doll's hair, and it had a really weird look, but it did give the patient some hair coverage on top. But luckily, we have much better technology and better, which leads to better results and more natural results. With today's techniques, you can, most patients would never know. Most people would never know if you met someone with a hair transplant or not, because it's just pretty much imperceptible nowadays. First of all, get a good night's sleep. This is a minor procedure. It's technically a surgery, but it's a very minor surgery. The other things to do, get up and just kind of relax, have a good breakfast. We want you to have some food in your system so your blood sugar is good and you have some nourishment for the day. We don't want you to drink coffee with your breakfast, unfortunately, though, because coffee has caffeine. And we also use some medicines that have some epinephrine or adrenaline in there, and that's a stimulant, and the caffeine could sort of add to that. So for the day of surgery, we want you to avoid caffeine when you come in here. And we'll give you, if you have a soda to drink for lunch during the day of the procedure, we'll give you Sprite, something without caffeine. In addition to those things, we want you to come with clean, dry hair, take a good shower, scrub your hair really good. Wash it carefully, get all the product out, any topics, any hairspray, any Rogaine, get all the chemicals and products out. So wash your hair maybe a couple of times and rinse it really, really well, and get all the soap and all the residue, all the chemicals out, and then dry it really well. So we want you to come with clean, dry hair, and we want you to come in comfortable clothing. Don't bring jewelry, you don't need to put on makeup and all that. Just maybe a tracksuit. We want you to wear a button-up shirt or a zip-up shirt. and something you can lounge around in all day long. And nothing you have to pull over your head. So no tight shirt or t-shirt that you have to pull over your head, because we don't want to touch or mess with the grafted area at the end of the day. So and while you're at the office, we'll give you a little patient gown to wear while we're doing the procedure. If you have hypertension or high blood pressure, you want to take your blood pressure medication just like normal on the morning of surgery, and then drink lots of fluids, and we'll keep you hydrated during the day, and that's the best way to prepare for the day of surgery. In general, you want to take it easy for a couple of days. If you take it easy for 48 hours, 72 hours, that would be a great thing. You can go back to work, during that time frame, but really it'd be better if you can just chill, lay around, depending on your procedure and how much we did and where we did the surgery on your scalp. That could determine some different factors involved. But you want to just prop up, lay on the couch, prop up in the recliner. You walk around, watch TV. You can do some minimal work around the house if you want to. I don't really want you to be sweating or getting dirty. Don't clean the attic, don't mow the yard. Things are going to get you sweaty. They're going to get dust or dirt on your scalp, because you do have a little wound here that's healing, and we want that to heal in a clean environment. During that first post-operative week, after a couple of days of relaxing, you can kind of slowly increase your activity level. The first 2 days, we have you mist spray the scalp where we transplanted the hair with saline spray. And the saline spray, you can put it in the fridge and get it cold. It feels good, patients tell me. And just do a little mist on the transplanted grafts. On the third, fourth, and fifth day, you can actually wash your hair with shampoo, but we don't want you to scrub it or touch it. We just mix some shampoo in a plastic cup and warm water in the shower. Just use shower water. Lean your head back and just pour shampoo over your scalp, 2 or 3 cups full of that, and then clear water to rinse it. And you don't really need to touch it or scrub it in those first few days. And sort of like when you wash our child's hair, lean them back and then just pour over it. And then on the 6th day, you can let the water hit you directly in the scalp from the shower head. We don't do that earlier because we don't want to take a chance of dislodging any grafts if you have a high pressure shower or something. And on 1 week later, on the 7th day after surgery, you can scrub it and get all the rest. If you have any scabs that are remaining, you can get those off of there. And that's pretty much it. We will give you some post-operative pain medicine for a few days and some antibiotics for a few days, and we'll have you take those during that week. This is variable, and it really takes about a year to get the final result after a hair transplant. You can sometimes see hair growing from the day of the transplant surgery, and sometimes it'll grow for a while and then shed, and we call that shock loss, but it's temporary. The hair just sheds out of the hair follicle, and it'll regrow, and that's a temporary phenomenon. You usually start seeing it around 6 months, really start to come in pretty well, but everyone's different. It could be a little earlier, it could be later, and that's why I'd say give it up to a year to sort of get your final result. Hair transplant complications are very rare, but yes, there are serious complications. Can be anesthetic, reactions to the medications, hair infection of the scalp after a hair transplant, which is, to prevent that, we use antibiotics also, and it would be treated with certain antibiotics. Bleeding or chronic soreness is possible, or a hypertrophic scar, or even a keloid is possible. So we want to know if you have any history of keloids in your family or scarring problems. You can even have, in rare cases, some numbness that's permanent, but that is extremely rare. For the vast majority of patients, there are no complications whatsoever. There are several temporary things that we see right after surgery that we're expecting. They're not really a complication. You're going to have a little bit of swelling here in the scalp for a few days. It'll be a little red. The redness and the numbness will go away over a few months. But they can take 3 or 4 months sometimes to go away, or occasionally even longer. But those are the things that we expect to see after surgery. The actual permanent complications are exceedingly rare. Many patients can be treated with a hair transplant. It's sort of a tried and true kind of instant gratification, or close to an instant gratification solution that you can do. We use it for male pattern hair loss. We treat female pattern hair loss also with hair transplants. Most patients can be considered for surgery once they reach 20, 21 years of age. We used to say 30 in the older days, but now with the FUE, which is a less invasive procedure, and there's less scarring and any kind of permanent damage to the body, we've sort of lowered that number arbitrarily to around 20 to 25, somewhere in that range. Patients can consider a hair transplant procedure, depending on their particular case, of course. Oftentimes in younger patients, we will start them on hair loss medications, such as finasteride and things like that, to prevent, to try to stop the hair loss at that point. And we've seen some very young patients, even in their early teens, like 13, 14, believe it or not, that have shown signs of male pattern hair loss. Other things with being a good candidate, you want to have a good donor area, obviously. So we have to have enough hair to work with in the sides and in the back. So the donor area is sort of this horseshoe area here in the back of the scalp, where we take the grafts from, basically. So the grafts are borrowed from there. There's no way to really clone hair or do a stem cell growth of brand new hair at this point. That is that's being worked on by numerous research labs around the world. But to my knowledge, that's not something that's commercially available anywhere in the world right now. As I mentioned, patients with traction alopecia are also candidates for hair transplant. We grade hair loss in men from 1 to 7. It's called the Norwood-Hamilton hair loss scale. And if you're a Norwood 7, that means that's the worst case. That means you have everything is gone up here. You just have this horseshoe of hair back there. Even those patients can be treated with a mini hair transplant using with their available donor. And what we can do is actually do a very small hair transplant to recreate the hairline where we want it and make it with your own, your existing hair, which of course grows. You can cut, dye it just like normal. And then behind that area, to cover the big area that's not able to be covered because we don't have enough hair from the donor area, we can either put a hair system to cover that area, which is human hair that's sort of bonded to the scalp and styled, or you could even, in some cases, depending on your hairstyle, consider scalp micropigmentation to sort of color the scalp and make it appear like there's hair there. That can work well for patients that want to wear a very low, buzz cut type of look. And so you can blend these techniques together to give the appearance of a full head of hair, even with advanced hair loss. That's hard to say. It depends on the patient and the degree, what their expectations are. Some patients are glad just to have a little hair back on their head. Some patients want complete coverage of their hair loss with as dense of hair as possible. So that sort of depends on the patient. Most cases nowadays, it seems like, are 2,500, 3,000, even up to 4,000 grafts. So the idea with that is, since this is a less invasive procedure now, we can just do as much as we can in one sitting, because more hair equals better results, to be honest with you. It's like, as Dolly Parton says, the higher the hair, the closer to God. But you want more hair in your scalp, and it gives that just a better look, a better result. It's more dense, it's thicker, and that's what everybody shoots for. And so we've achieved that with fewer sessions. A common thing nowadays, even with these larger sessions of hair transplant, say 2,000, 2,500, 3,000 grafts, a lot of times we'll do one procedure in the front to correct all this hair loss, and then a second procedure in the back for the crown. So I would say if you have a lot of hair loss kind of front to back, you probably will end up needing 2 sessions or 2 procedures if you want complete maximum coverage. And of course, that's given the fact if you have enough donor to work with. These surgeries are simple one-day surgeries. They're minor, but they take a long time all day for those kind of big cases, usually around 10, 12 hours. But you come in the morning and you leave in the evening and you got a bunch of stubble of grafts that's everywhere where you wanted new hair to be.